Well, good morning again. We, with the Department of Social Services in the state of Virginia, are excited about Medicaid expansion. We have been working tirelessly with our partners to make this a successful event. It will kick off officially November 1st. That's when we will be accepting applications. And today I will be going through the process, just giving you an overview about the program, possible tools that you can take back in your community and pass out information to those that potentially may be eligible. The eligibility period will begin January 1st of 2019. And so today we're going to look at who is actually eligible, what services will be covered, the new adult coverage uses and what our current program is offering, medically complex enrollees, and that will be a topic that specifically deals with certain specialized needs that our citizens need and how we can identify that and connect that with our healthcare providers. We have new adult coverage initiatives, and then actually how do you apply for Medicaid and how our partners in the community can access some state resources and get trained and spread this news throughout the state of Virginia. So the rules for Medicaid have changed, and in the past, many Virginians have been denied full coverage Medicaid. Those that were in the age bracket of 19 to 64, we were only offering limited Medicaid coverage to those individuals, and that was based on their age and an income guideline. But now we are excited to say over 400,000 people in the state of Virginia are potentially eligible for a full coverage health insurance program. And we at the state and the localities are using various methods to reach out to these potentially eligible individuals so they can get on board and start receiving these benefits from full coverage health insurance. Some of the people that you may wonder who could potentially be eligible. Think about children that were on their parents' health insurance up until the age of 26 and they aged out. Think of those individuals that are waiting 2 to 3 years for a Social Security disability determination and eligible for Medicare. Those individuals who are low income and can't afford a full health insurance program, and then those individuals who are struggling with either some kind of chronic medical condition or potentially a drug problem, and those individuals that are coming out of our correctional systems that while they were in the correctional system, they were diagnosed with some health problems, but in the past had no means to sustain medication to keep up their health. So these are a wide variety of citizens that we are targeting to enroll and apply for our Medicaid program. So you can see here in the past, like I said, only families that had children and were at the extremely low income level were eligible for Medicaid. Children were eligible. Elderly folks were eligible, people over the age of 65. Those that were disabled were eligible, and of course, pregnant women were eligible. So by opening up this new category of Medicaid, we are going to reach so many more citizens in the state of Virginia. I have provided you with an income chart here for our eligibility. So not only if you're between the ages of 19 and 64, you do have to meet 138% of the federal poverty limit. So this is a really quick tool that people can look at to kind of gauge based on their household size if they could potentially be eligible. Now just keep in mind with eligibility, we do look at citizenship status, we do look at gross income, and we're looking at the household size. So just being between that age group and being income eligible doesn't necessarily approve someone for this full-time coverage. What actually is going to be covered by full coverage Medicaid? Well, full coverage Medicaid is just like anyone else's full coverage health insurance. You're going to be able to have your doctor's bills, your hospital bills, x-rays, prescription drugs, home health care services, behavioral health services, rehabilitative services, family planning, medical equipment and supplies, and preventive wellness services, and many more. But I want to make this very clear. This is health insurance. This does not include vision insurance, and this does not include dental insurance. We do not offer that currently for our adult Medicaid eligible recipients as of this time. Only children and pregnant women are offered dental insurance in the state of Virginia. So I know we still have many people that, have dental problems and elderly people that need eyeglasses. And so we would still have to use other resources in the community to provide those needs. Does anybody have any questions as of this point? So let me tell you about what happens once you get approved for Medicaid. Once you get approved for Medicaid, you will be sent a blue and white plastic card with your Medicaid ID number. And that is sort of your billing number that you would take to the pharmacy or to your doctor. In the first 60 days that you are eligible, the state of Virginia will be sending you a packet, and you will need to select one of these 6 HMO or MCO providers. And that's another cost-effective way that the state can manage the Medicaid program. Years ago, the state was not connected with MCOs, and many people on Medicaid would use the emergency room as their primary care physician. So by connecting with MCOs, not only are we providing more cost-effective care, but we're able to target care for those individuals who have some chronic health problems, where we can, as a state and with the MCO, mail out some directives and different types of brochures if you have diabetes or if you've been diagnosed with another chronic problem, to help with that education on those preventive services. So these are the brand new MCOs that the state of Virginia is going to be going through the state. We've started in the Tidewater area, and then throughout the state we're going to be switching over. So currently we have some other MCOs that we're connected with. Those will eventually fade out and these will begin. So once a client decides which MCO that they select, they will actually be given another type of health insurance card with a separate billing number. So it's always wise when a client goes to any pharmacy or medical physician or hospital to present both cards to ensure that the correct billing number is used at any time. So this is going to be very important to get this message out. These are going to be individuals that are in the past that have never had health insurance. So what I'm trying to do and trying to encourage our partners in the community is when clients get these letters in the mail from the state, that they really take the time and figure out what doctors they have been seeing or that they anticipate seeing and match them up with the MCO that is associated with them. Because if they don't select an MCO, the state will select for them. Now, of course, within a 30-day period, anyone can call the state and switch MCOs, but then that is a delay in services because you're already connected with one for 30 days. So this section right here, medically complex enrollees. This is a new question that we have put on the Medicaid application. In the past slide, not only did we talk about our MCOs, but our MCOs will also be doing some coordinated care plus. And by having individuals answer this question, it will identify people that may need some more enhanced care. For example, I may not need to go into the nursing home, but I may need a home health care nurse to come out and help with something. I may need help with bathing. This is just one method that the state is using to readily identify those potential eligible recipients and connecting them with the right services with these providers. So of course, if you've been listening to the news in the past year, you've been hearing a lot about this work requirement and Medicaid, and several other states that have put through different lawsuits and people have been sued over the work requirement. In the state of Virginia, we have submitted a waiver to the federal government and have outlined a work and volunteer component. This is a future initiative that we look to about 2020 that will possibly be approved and we will enter into. But currently, there is no work component or volunteer component once you're approved for Medicaid. We as a state, like I said, have submitted that waiver, but all of those guidelines and rules and regulations need to be worked out before we get to that point. In the future also, there will possibly be some cost sharing and co-pays because some of the folks that are eligible or that at the high end of the income limit may have to pay a co-pay to use certain services. But that is not included in our initial eligibility for 2019. So how can you apply? We have various ways that you can apply for Medicaid. On the back table, I have provided you with little green cards that have the Medicaid number. So those that aren't savvy with a computer, have problems with transportation, all they have to do is call that number and they can apply over the phone. Also, individuals who would like to apply over the computer and actually track their application and upload documentation can do through Common Help. I have those cards that we can pass out. Another way that folks can apply for Medicaid is through the what is it called? The marketplace, thank you. Through the marketplace. So in November, of course, the federal marketplace will have opened up, and that program is basically individuals that are seeking some type of low cost health insurance. What the state of Virginia has coordinated with the marketplace, any individual that applies and that meets the potential criteria for this full covered Medicaid, the marketplace will actually process and approve those and send those already approved applications. So we're trying to not miss anyone that could potentially be eligible. We're soliciting folks in the community, and then those that are trying to go through the marketplace, if they meet a screening, we're going to try to enroll them that way. So these are just some of the ways. Of course, you can come in traditionally to the Department of Social Services, and we have an application. Again, we'll be taking applications starting in November, but the coverage will not start until January 1st. We already have recipients whose children are already enrolled, and we have SNAP recipients who have already been identified as being within this income guidelines. So we have already, through a a mailed communication sent out notices to them asking them to contact us so we can go through a few short questions and then enroll those. We're potentially looking at about 14,000 people in Prince William County that are potentially eligible for this service. And you know, that's 14,000 people that are going to have to look for new doctors, you know, maneuver the pharmacy and the healthcare in this community. So we're really excited about that. There could be a plus or minus that we capture some of those individuals who are already on our SNAP program and already have children that are eligible.
I have a question.
Sure.
So my understanding was people that made $12,000 or less could go on Medicaid, and anything $12,000 or more would be in the marketplace. Are you going to have an overlap where people that are in the marketplace, let's say $14,000, would transfer over to Medicaid? Is that what you were talking about just now?
Well, the income guideline is actually $16,754 for a household of one.
But that's new though, right? That's this year.
That's right.
It used to be $12,000.
Yes,
Okay.
and so now when people have to go back to the marketplace in November, they will be told that they are eligible and they will be switched over
Okay.
to the state. Yes.
Okay, and that'll be better for them too.
Oh, definitely, definitely.
Okay.
Now, of course, if you want to know any updates, the state does have a website that you can find different brochures, the actual PowerPoint here, if you want to present that back in any of your organizations, you can go to. And as you can see on the next slide, this is just what the state is showing you. You know, coming soon, new health care coverage, and also offers, this website offers you a tool, as you can see the arrow. You're not really sure how much income you make. We get this a lot when people apply at social services. People are primarily focusing in on what they bring home. We are looking at their gross income. We are also looking at their pay frequency. People that get paid weekly, bi-weekly, semi-monthly. That also is encompassed in determining their gross income limit. So this is a good tool for those. The next screen kind of goes through the questions on the tool to help people determine. But the bottom line is I would just encourage people to apply. If you're really unsure, or if someone only had a little bit of overtime and it put them over, you know, go ahead and apply, send us all their pay stubs, and let us make that determination if someone is truly eligible or not. And it doesn't mean that if you're denied because you're over the income now, if your circumstances change down the road and you happen to be below that income limit, please come back and reapply.
Can I ask another question? So if somebody's applying for this, let's just say somebody smart applies November 2nd, but they don't have all that information, you know, because the year's not over as far as their pay goes. Would they go back on last year's W-2?
Well, it depends on how they get paid. If they're self-employed, we're going to be looking at their 2017 tax return.
Okay, yeah.
If they're a wage earner and they get actual pay stubs,
Yeah.
that's what we're going to be requiring.
Okay.
So we rarely look at someone's W-2. We really want to focus in on what they're making that month, if we can.
Yeah, but if they're 1099.
If they're 1099,
Then you
then
have to.
we would have to do
Yeah,
that.
I get
Yep.
multiple sources, or other people have multiple sources. Okay, Thank you.
So of course, again, here's the website that shows the various different resources that you can access. We're just trying to get you out there to spread the word throughout the community. Tell your neighbors, tell your friends. You never know who could potentially be eligible. The last screen that I want to show you is the sign up now. There you go. The sign up now is basically a 4-hour training for those folks that are interested in learning more about this Medicaid process and helping people fill out applications. We encourage our community partners to take this training. They will be trained by the Department of Medical Assistance Services at the state, who actually manage the Medicaid program, and really kind of go in a little more depth in trying to retrieve that information, specifically about capturing the income on the application, filling out your citizenship status, compiling who actually is in your home. Because the way we're looking at it with social services, we're looking at your tax family. So you could have grandma, granddad, mom, dad, and 3 kids. And if they all file taxes together, that's the household we're looking at. But if the older adults file separately, then we're only looking at mom and dad and the children in their tax filing status.